social media gurus.
Nothing. Okay, I guess I qualify.
JB, my younger daughter. I've got my TikTok guru. I have the matriarch of the family here, who is the metaphysical guru. And we have our producer around the corner there. She does not want to be seen because she is producing.
That's funny.
All right. So I always start off my lives by saying who I am and what I'm here for. Okay. So I'm Dawn Mandeville. I'm a board certified OBGYN and a menopause certified specialist. And my kids joke with me, but every time I say it, I have over 25 years of experience. And actually I've counted from residency until now, it's actually 31 years. So, but we're not really counting. But, so I know a little bit about this women's health and a lot about menopause. And we're gonna talk about something very special today. Live. Can you all see me okay? Just give me a heads up. Okay, good. I think we need to rotate this just a little bit.
Yeah,
All right. Beautiful. Okay, all right, here we go. So today's really special because I have my family with me. I have my daughters with me. Jenna's 23.
I was about to say you better get it right.
Lauren is 27.
Nope, 26.
She will be 27 this year. She is 26 years old. And my mother, Honey, is...
Don't even try it.
Honey also goes by Lotus Hawk, so we may be calling her different things. I may even call her Mommy at certain times. So, but this is really special today because I actually have 3 generations present today. And we're going to just talk about what menopause is to them and how they perceive it. And hopefully this will resonate with you all. As you're listening, call your mom, call your sister, call your girlfriends, have them hop on, because this is going to give us a lot of information as to how menopause was perceived, is perceived, and what we want to do going forward. And that's part of my message, not only to educate, not only to advocate, but to spread the word so that that word of menopause, perimenopause, midlife health can start to be propelled forward and normalized. So that's what we're here for. Again, in the comments, what I would love you all to do, tell me what generation you are. Are you Generation X? Are you a baby boomer? Baby boomer. Are you Generation Z? Gen Z. Can't say generation, I gotta say Gen Z.
Yeah, you gotta be with the times.
And just, comment in the comment section who you are. And also, one of the questions I have for you is, did your mother tell you anything about menopause? So let's get started. I'm gonna have Honey/Lotus Hawk introduce herself first.
Hi. I'm so glad to be here with my daughter and my granddaughters. I am Harriet Mandeville, but I also go by Lotus Hawk in my energy, way that I think about life, and intuitive consultant, I'll put it that way. And I'm still acting, I'm an actress, and I'm loving this going back, thinking about menopause, but introduce myself. So that's basically actress, still doing commercials, still doing energy work, intuitive work as Lotus Hawk, writing. I've written a book, Opening, Lotus Hawk's Prayers and Meditations. And what else do you want me to say?
No, that's it.
That's it. I sing too.
Yes, thank you for being here, Mother. And this is Jenna, otherwise known as JB,
Okay.
Downtown Jenna Brown, Brick House Brown.
All the things. I'm Jenna. I live in New York now, but grew up in Atlanta all my life. This is my wonderful, wonderful mother. What else should I say?
I'll ask your questions
Um,
later.
Yeah. Okay. I'll save the tree plants.
All right. And then Lauren.
Hi there. My name is Lauren. As you remember, I'm 26.
Yeah, I was there.
I live in Boston, but
27
I'm moving to
this year.
Chicago soon, and excited to be here with you all.
Yeah.
All right.
Very fun.
Let me just do this really quickly. Let me define perimenopause, menopause, and postmenopause, because I think that will help our discussion a little bit. Perimenopause is the time before menopause. So basically your ovaries are still working, but they're not working well enough to hold off the menopausal symptoms. So your ovaries are still working, you're still getting a period, the ovaries are not working that well, but you're having menopausal symptoms, but you're still having a period. That's perimenopause. Perimenopause can last anywhere from 4, 7, 10, even 14 years. Probably longer, probably feels like forever. Menopause. Menopause is actually a moment in time. It is 12 consecutive months without a menstrual cycle. Once you reach that day of the 12th month, 366th day, that's considered menopause. And everything after that is considered postmenopause. We can use postmenopause and menopause interchangeably, but it's just how we document where you may be in your phase of life. So, honey,
Yes.
Lotus Hawk.
Yes, ma'am.
When you were growing up, did anybody talk about menopause with you?
Not really. I know my mother had a hysterectomy, so that may be some kind of something that happens to women when they around the menopausal time. But I remember my mother was in her bedroom and my father came out and the room was dark, and I was like going to talk to her. Maybe I was, I don't know how old I was then, 12, 13, 14. And I was going to go in there, and he said, "Oh, no, your mother isn't feeling well." And only later on did I realize she was going through some menopausal feelings. And around that time, that's when she had her hysterectomy. What was the question again?
What did did anyone talk to you? Brain fog is real, even in the postmenopause.
And I don't care.
Did anyone talk to you about menopause?
No, not really. I guess with our friends we called it, "Oh, we're not feeling good, PMS, oh, I feel this way or I feel that way." But nobody, until symptoms started, and mine weren't that big, but large, I couldn't sleep. I had insomnia. And maybe, irritable. But it was like irritable. You're irritable that day, and then life goes on. So it was a lot of life goes on, and that's the way it is.
Okay. All right. Jenna, I would ask you, did your friends, do they think it's weird that your mother specializes in menopause or perimenopause? Do they think it's weird?
No, not at all. It's funny. It's like one of the, whenever they ask, they're like, "Oh, what do your parents do? What does your mom do?" I feel like it's like the really cool answer, honestly. And I'm like, "Oh, she's an OB/GYN." They always go, "Oh my God, that's so cool." Like, and then they ask me a question about their health, and I'm always like, I don't know, just because I'm her daughter, I have no idea. But no, I don't think it was ever weird. I think growing up though, it was both informative, but I think as I've gotten older, I've realized like what we almost talked about at home or became very normalized was not in fact normal, and definitely not things that people kind of brought up. I mean, it's funny, like we would talk about things at the dinner table that like nobody would ever talk about, but again, it's all normalized for me. So I think that was the only kind of weird part that I realized later on. But yeah, no, I think my friends are very supportive. I think they think your TikTok's very cool. So every time I show people, they love it.
Well, I will say this. Jenna just talked about normalization, and that how we feel at our dinner table, there are lots of conversations that we feel are normal, just as you said.
Yeah.
So this entrance of me talking about menopause and perimenopause, although it's normal to us, it's not normal to probably 99.9% of everyone else. So that's why I think this is so special that we can talk about it from the perspective of those who may have talked about it, but also hopefully impart some information that will help women feel more confident or comfortable about talking about it. Lauren Brown. What?
No, I
Sorry.
had one point. I was like, it's normal to us, but I even feel like we didn't talk about perimenopause, menopause. Like, I think it took you going through it for us. Like, other things were very normalized, I think, in your field, but this specific topic was not. And I think that's even more telling that in a household where that's very, very normal, even this topic has not been brought up. So it's almost a learning curve for all of us, and obviously we're getting educated because you're doing the education, but it wasn't at the early stages. So, yeah. Go, Lauren, you don't get your passion.
I'm going to add some, as I'm thinking and hearing you talk. So I'm remembering my mother and her talking to her friends and me not really knowing what they were talking about. They were talking about, I'm 47 years old. And they were walking down the street about being 47 as if it was the oldest thing in the world. And I'm presupposing that they were going on to say, I'm feeling like this and I'm feeling like that. So that was one of my memories of another generation that's not right here at this moment. Okay. I just wanted to interject that as part of my story.
Mm-hmm. Lauren, what was it like growing up with a mother who is still an OBGYN?
I think it's, at the time, I think growing up, I didn't really know anything different, nor do I know anything different now. But I think one thing that I really admire, and have come to admire more and more about you, is your work ethic and the beauty of bringing life into the world. And I think it's really cool that, although you have gotten into menopause education, especially over the past 10 years, especially in the beginning of your career, you were focused on bringing life into the world and caring for women, which is something that not a lot of people are able to focus on, and that is a desperate need in our society. So I thought it was pretty cool to say, hey, my mom puts on blue scrubs and she's taking 24-hour call shifts, 48-hour call shifts, and she might not always be home to roll my hair up. Not that that's lasted long, but she's always able to take care of people, and I think that that's something really, really admirable and inspiring to grow up with. Well, she won't cry.
I was just going to say,
there she goes.
This we may not make it through this. Lauren, you said something about the last 10 years. What I will say is that this has been a journey for me. This has not been a long journey. I would say that going into menopause has been a long time. It's been 10 years plus for me. But my journey into menopause medicine is a lot shorter than that. It's actually about 3 years. And it speaks to the evolution that we're having right now with menopause medicine and perimenopause and menopause. Even the OBGYN doctor didn't realize she was in perimenopause or menopause. And that was because she had a life-threatening issue. Okay, so there are certain things that prevent you or that are contraindications to hormone therapy. I will say I always knew I was going to take hormone therapy because I didn't want to go through what I saw my patients going through. And that was not being happy when they came in, not quite feeling themselves, being fatigued, discussing weight gain, discussing all of these symptoms that honestly, because I hadn't learned it in residency and because in 2002 we were told that hormone therapy was bad, I turned my head because as a doctor, you do no wrong. You don't give somebody that they say is bad for you. But on the other hand, I knew I wanted to take hormone therapy because I didn't want to feel badly. But after having a blood clot, which is a contraindication to hormone therapy, I could not take hormone therapy. So I honestly think that my brain turned off to all the possible symptoms and anything that could be perimenopause or menopause. And 10 years ago, we didn't talk about perimenopause. We might have talked about menopause, but perimenopause, no. Now that I'm into this, I am literally having flashbacks of things that my patients are telling me, things that I'm reading, and I'm saying, oh, geez, that was me. That's me. That was me. Oh my God, that's me. Oh, that's still me. All of those things are now coming to fruition. And I feel like this is a moment for me to use that information to say, look, I've been through it, still going through it, and now we have more information and we can present it to our patients in a different way and let them know that they have options. Even though I don't have all the options, I do have some. We can get to that later. But some of those options can be life-saving, can be quality of life-saving. So just know one of the reasons why I speak about this so passionately is because I want women to know that they have options. I want women to know that we are not forgotten. I can tell you, Generation Xers, we're not taking this SHIT. We're not. We are taking this by the horns and saying, not us. And I think that's another reason why all of this conversation is increasing. And I am now one of those to say, that was ridiculous. And that we need to, as a group, start to look at evidence-based information and believe that information and believe that you have the autonomy to make choices for yourself. Somebody says, nope, don't take that hormone therapy, it's going to cause breast cancer. It actually doesn't. But we can talk about that later. But my point is that this has been an evolution for me. My family has watched it. I have started to ask my mother what she's gone through. I had a conversation, I remember I was in the car, and I asked you and your girlfriends. My mom has a group of college mates that, I'm not allowed to say how many years you've graduated from college.
20.
But I said, well, what did you guys
50.
do?
Right.
And she said, we had that PMT. I said, that PMT? She said that, we were all irritable. We were irritable. We didn't like our husbands. We were just irritable.
PMS.
And I said, PMS? She said, oh, yeah, PMS. So it's you kind of have to kind of pull that information out. So that's one of the things that as we're talking and talking more, I'm getting information from her. I'm imparting information hopefully to my daughters so that they can take this and bring it forward. So having said that, what did you think menopause was? Or did you know what menopause was?
I think I definitely didn't know. I thought, actually, the only thing I knew about menopause, or so I thought, was that, that's how you know you're getting older. And my image of someone getting older was someone in their 70s and 80s, not necessarily their late 30s for perimenopause, 40s and 50s or later for menopause. And so I think something that I've really appreciated is you dispelling, one, all the myths about perimenopause and menopause, but also really educating me in terms of what I can expect in 20 plus years. Hopefully it's still a ways off. Fingers crossed.
Fingers, yeah.
But also I think the
27.
more important lesson that I've learned is how to advocate for myself and knowing when to go into my appointments prepared, even as a 20-something-year-old, knowing exactly what I'm going to ask my doctor that has to do with my life and my circumstances, and building that muscle early on so that I can eventually take that when I enter into that next phase of life. So it's definitely been educational. It's definitely been inspirational, and I think also just really, really helpful to see an example set for how to approach this phase of life. Even though I'm glad I'm not there yet. I mean, I'm not in a rush.
Do me a favor, for those who are listening who have joined in, comment for me, what did your mother tell you about menopause? Also comment on
your personal experiences.
Yeah.
Outside of that,
Right.
not only what did your mother share with you, but what did you hear from your friends?
Mm-hmm.
What has your personal experience been in terms of your menopause education, and how has that potentially changed over time, or what gaps are you still looking to fill? We're just eager to hear.
Jenna. You had a friend that came. Jenna's graduated from high school. college
how old am I?
last
Okay.
year. I'm getting it all. And one of her friends said, Dawn, not Dr. Dawn, not Mrs. Brown, Dawn, you can go viral.
She tries to be one of the girls, so she's Dawn.
And I said, viral? What are you talking about? She said, you can go viral. This information, even as a 22-year-old, she recognized that this information was important. So tell me how you think social media is being used and how I can continue to use this platform to educate women and anything that I can do differently. And you all can put comments also how we can do this differently or what will continue to grow this conversation. So.
No.
No, I just
How we can continue. Well, I think one of the best things about social media is just how many people that you can reach, and the true diversity within that group. I think that what you're doing really well right now is being very true to yourself, true to your experience. I mean, you could have come on here and told 100,000 people that you were an OBGYN, you knew about menopause, you knew everything, you're not learning anything every day, it's not different for other people, but you're not, and I think that's very, very important, especially in the day of social media where everybody's trying to put on like their best face, I know. But no, I think that's something that you're doing really well, in terms of continuing to do, so I know you touched on Alana, she has her own page and she's just been really into women's health and advocacy as well. But I think what you can do on your page is connect with a lot of younger viewers as well. Because I think one of the things that Lauren and I have learned the most is not only, oh my gosh, what is perimenopause? I didn't know what it was until about 2 years ago. But understanding how to be better for your mom, your grandma, and how they can be better for you. So if you were to have told me, hey, I'm going through this. These are my symptoms, I'm going through this is what it's called, I think that is something that I think that you should really say on your page, because I think that this is not only a larger discussion for people of this age range, but it's almost how can you have better relationships with your family, and how can we better understand what you're going through, because you just saying, I feel like shit today. Sorry. That to me as a 13-year-old who is very self-centered, always thinking about herself, thinking about like what's going on in her middle school life isn't necessarily helpful, right? Or I'm not going to have the emotional, empathetic capacity to know that and understand it and be like, wow, my mom deserves better today. But being very open about that and what we can do, I mean, that's like, I think that's something that you should really broadcast on your page and make sure that you're really connecting with younger viewers especially, and obviously we can help with that as, what do we say, Generation Z, or would you call us? But no, I think that's like that's a huge point that I think you can build on for sure.
One thing you mentioned just now was something about what in a family, who knows what's going on or lack thereof. Partners. A lot of us have partners, or a lot of us live with people. And that to me is really important. And I'm going to ask my mom a question this in a second. But not knowing what's going on with yourself can make your partner or your family wonder, what the hell is going on? For example, what is my nickname, ladies?
Smoky Mama.
So
that was coined when we were like 5, so that's impressive.
So that would be perimenopause. So Smoky Mama. Why Smoky Mama? Mama was irritable. Mama could rage. Mama didn't take no. If somebody made Mama angry, Lotus Hawk would come, because Lotus Hawk is very similar.
Zen.
No.
We're honest here.
So, we didn't coin it as perimenopause. It was Smoky Mama. That probably was my perimenopause. And then your partner. Your partner can do one of several things. Can sit there and take it. Can sit there and then turn in the complete other direction and say, she's not right, I'm just going to leave her be. Or can try to help. But a lot of times they don't know what to do. They don't know what to do. And you can't explain what's going on with you to tell them what to do, other than to stop breathing too loudly, right? So let's also keep in mind that those who live with us, around us, are affected also. And once we start to hopefully get more information and realize that we are going through a change that we have little control over, know that that affects those around us. So this is where that education starts, to try to figure out and ask questions, because the more questions you ask, hopefully the more answers you will get. And that will allow you to now formulate ways to navigate this a little bit better. You're gonna need help. Nobody can do it on their own. I can only do it because I'm reading stuff, but I certainly can't do it on my own. And I have not been doing it on my own. So I asked my mother this question because my father is an OBGYN. He is actually still practicing in some capacity. He was in solo OBGYN practice in the 70s, the 80s, the 90s, and early 2000s. And so that is right around, hormone therapy was the bomb in the 70s and 80s and 90s. 50+% of women were on hormone therapy until 2002, when we were told that hormone therapy is bad. And this is a question for you. What percentage of women right now do you think are on hormone therapy? So 50% before 2002, before the WHI study came out and said hormones are bad, that it increased the risk of heart attack, stroke, blood clots, and breast cancer. After 2002 up until this time, take a guess. What percentage are we getting there? We're
This
looking.
is also
I
a
was gonna
test
say,
to see
like, drum roll.
if you've listened to
This
her
is-
videos.
So
All right, we got
I see 20%, 10%, 60%. So what percentage of women in the U.S. right now are on hormone therapy? Okay. Do you know? Okay.
Let me throw out 13.5.
Okay. Lauren?
I don't know.
14%. 4%.
That's a
So
cop out.
14%. That's
Four.
4 people in America. That's that statistic. African Americans in America.
We did just look at
4%. 4% of women in the United
Wow.
States are on hormone therapy at this moment.
Arguments.
Okay. So my question is we call my father Poppy. Did Poppy talk to you about menopause? No. First question.
I'm sure.
No. As an OBGYN, okay? This is the critical part. Somebody in the know, somebody in medicine. Did he talk about it? Did you use the words menopause or perimenopause?
Or in a sense that I was on hormone therapy, and it was at that time he said, "No, it's time for you to get off."
Well, how did you go on?
I had couldn't sleep, and as I look back, and I just wanted to interject, this conversation is also good for people in my generation because it's allowing us to give ourselves grace in that all those things that were happening back there because of perimenopause or menopause, it wasn't discussed, it wasn't even on our radar. So now you look back, oh, is that why I did that? Or is that why I didn't do that? So it's, my thinking is, well, if I realize that, and I'm going to give myself some grace about that. So no, and so as a physician and as a husband, it was not. It all depends on the personality of a person also, but it wasn't. It was just being. I know this information, and to be safe, you should come off of it. Come off hormone therapy. I was kind of lucky. I didn't have bad symptoms, but maybe emotional symptoms as I look back on, well, I didn't feel like doing this. Well, why didn't I? Maybe that had something to do with menopause. So I'm speaking to my generation. Look back on it and see what you did or what you didn't do, how you felt. And then if it was because of how you were feeling about the change. Oh, they called it the change. Yes, the change. Like I said, give yourself grace. And look on it not as a terrible thing that maybe you didn't do this or you felt this way. It was because of some information you did not have.
There's a question that came through that says, do we really need HRT? Whew, that's, sorry, Instagram. Ouch, that hurt too, didn't it? Thank you. Ooh, no, it's having a moment. That's having a moment too. Okay, do we really need HRT? HRT, otherwise known as hormone therapy, hormone replacement therapy. I will tell you that a little education. So our ovaries are a command center. When we're born with 1 to 2 million eggs in our ovaries. The eggs help to produce our estrogen, our progesterone, and our testosterone. When those ovaries start to decline in their function, they're not producing those hormones as well. So by the time you're 30 years old, you have used up 90% of your eggs. And by the time you're 40 years old, you have used up around 97% of those eggs. So your ovarian function starts to decline. With that, you feel things because estrogen, we need estrogen for just about every cell in our body to work properly. So when you don't have a good supply of estrogen, things don't work well. Now, do we need it? We know that hormone therapy can, in women before 60 years old or within 10 years, now that doesn't mean that if you're over 60 or you're more than 10 years out of your menstrual cycle, you can't have hormone therapy. But there's something called a window of opportunity that if you start hormone therapy or hormone replacement therapy in your 40s and your 50s, that you could potentially have a decreased risk of cardiovascular disease, a decreased risk of bone loss, a decreased risk of insulin resistance, and possibly type 2 diabetes, and possibly a decreased risk of dementia. Now, that doesn't mean that if you don't take hormone therapy, you are going to get all of those things. It just means that we know that with a good supply of estrogen, feeding the estrogen receptors from our head to our toes and everywhere in between, that there is less change that goes on in your body. Again, this is more of a personal story as well. Part of my being upset about not being able to take hormone therapy and part of talking about this and reading about it is I feel like I'm on the outside looking in because I know and I believe in all of the benefits of hormone therapy. It doesn't mean that you have to take it again, but what we do know that there are benefits. And those who cannot take hormone therapy, maybe because of a breast cancer risk, maybe because of a history of breast cancer or cardiovascular disease, heart attack. I saw a question about atrial fibrillation, which is a heart condition where your heart, the electrical system in your heart starts to malfunction. Those who might have had a stroke, those who've had blood clots, or those who've had other cancers that may be sensitive to estrogen. Those women are not good candidates for hormone therapy, but see, when you put that like that, then I get confused and I lose my train of thought. So basically, those women who cannot take hormone therapy, hope is not lost. Okay, we have other options. Do not feel despair that you're looking outside of the window on the inside and everybody else is feeling great. Hot flashes are gone. They're sleeping well. They don't have joint pain or muscle pain. Their libido might be fine, might not be fine. They may have other issues that other women have in terms of vaginal discomfort or pain with intercourse or urinary tract infections. All those things that we know estrogen can be helpful for. Those women who can't take it, they feel like they're lost. And that is something that is a big question that I get all the time. What should I do? You do have options, and we can do a whole live on what options you have for the symptoms that you have. But do we need it? No, it's not mandatory. Can it be beneficial to a lot of things? Absolutely, yes. So I hope I answered that question. Did it sound like I answered the question?
It sounded like you answered it to me.
You gave information, whether you answered the question or not. It's fine.
Okay. Let's see. Okay. There's a question. I have been, no, don't turn it now. I can't. I've been on HRT for 15 years and I am 62 years old. Should I consider tapering off? Awesome question. We talked about the Women's Health Initiative, WHI study. That's the study that started in the 90s and that in 2002 was stopped abruptly because of an interpretation of an increased risk for breast cancer and potentially heart attack, stroke, and blood clots. Okay? So over these years, these many years, again, 50% of women were taking them at one point, and it dropped dramatically because women were told that it was going to kill them. And so women stopped taking it. And now we have learned through this study, this same study is actually a fantastic study. We are still getting great information from this study. So what they didn't tell us was that 2/3 of the women in that study were in their 60s and 70s. They most likely came into the study with chronic disease already. Some were on hormone therapy before, some were not on hormone therapy. Some basically came in with an increased risk and might have even had breast cancer at the time of entering the study. We don't know that for sure, but based on age, based on maturity, all of the risks that we quote for hormone therapy, increased risk for heart attack, stroke, blood clots, and breast cancer, come with age and not so much the hormone therapy. So then they looked at the women, not the 60 and 70-year-olds that might have had this higher risk. They looked at the women in their 40s and 50s and realized that those women actually had more benefit than risk from hormone therapy. This is why the statement of most women are good candidates for hormone therapy before the age of 60 or within 10 years of their last menstrual cycle. Again, you can be over 60 if your menstrual cycle was less than 10 years, or even if you are over 60 and your menstrual cycles are more than 10 years out, you're still a candidate. You just may not be the best candidate. And that's the thing. 60 is not a magic age. 10 years is not a magic age. It's just we're looking at risks and benefits. If the benefit outweighs the risk, you can actually continue to take hormone therapy until you leave this earth. I've had patients say, you're going to have to pry it out of my cold, dead hands before I stop taking it. Okay. Cold, dead, cold, whatever. You're going to have to pull it out of my hands when I pass away. So to answer the question, you don't necessarily have to taper it off. If you don't have any contraindications and you are still healthy, you can continue to take hormone therapy until you leave this earth. If a contraindication comes up, like cardiovascular disease or cancer, if you're high risk for something, have the conversation with your doctor. There's something called shared decision making. Okay? Shared decision making is basically having a conversation with your healthcare provider, hopefully learning all of the risks and benefits and getting great evidence-based information, matching that with your history, you all having the conversation, and then you deciding how you want to go forward, especially with taking hormone therapy or not. So I have several patients who have had a history of breast cancer who are taking hormone therapy because they feel that their quality of life is so affected without it that they'd rather take the small risk of a recurrence of breast cancer to have a better quality of life. Okay. What type of hormone therapy did you take?
The pill, I don't know, and I remember.
I actually remember. Was it a purple pill?
Yeah, yeah, it was.
I remember seeing it.
Yeah, and I don't remember the name of it or anything. Prem-Pro, and you know I did a prep job for HRT.
You did it for
Fem
HRT.
Fem HRT,
Yes.
right? I don't know what the difference would have been if I had continued to take it, but you're talking about symptoms, and I'm saying, I had that symptom. Wow, that's interesting, but to look back on it, it's really great for me to talk about with my friends, especially the group of friends you mentioned. Girl, you remember when that was happening? Yes, I do. Okay, well, that's okay. That it was because of this, not because you were, something was going on that made a negative for you. It was something medical, that could have been, you could have changed it at that time if you we had known. And now we do, and like I said, I'm using this word, give yourself grace and move forward,
What I would love is if you talk to Aunt Linda, Aunt Kathy, Aunt Frances, Aunt Sharon. I would love for you to have a Zoom or a talk with them to see what their experience was, what they knew then, if anything, and what they know now, and what they would want to have done differently.
Right. And what would they have done differently?
Yeah. Okay. I'm going to answer another question. I think this was supposed to be for 45 minutes, but I always go over, so I hope you'll hang in there with us. How many different types of HRT are there to choose from? You have many types. I'm going to kind of go in the categories. You have oral, which is a pill. You have transdermal. Transdermal can be anything through the skin, whether it's a patch, whether it's a gel or a spray, or even there's a vaginal insert that absorbs through the vagina mucosa into the system. And you also have local vaginal hormone therapy, estrogen. Okay, so those are the FDA approved types. You can take any one of those. Unfortunately, oral has gotten a bad knock recently because there may be a very slight increased risk of blood clot formation because it has to be metabolized to the liver, through the liver to become active, and that may spit out a few other coagulation proteins, slightly increasing the risk. But if anybody used to take birth control pills has a far higher risk for blood clots. So if we kind of think about that in terms of the relative risk for birth control pills versus menopause hormone therapy, birth control pills actually have a higher risk. But it doesn't seem like people are as afraid of birth control pills. So just keep that in mind when you're thinking through this. Transdermal, anything through the skin. It does not have to be metabolized through the liver, and that's why that risk of blood clot formation is a little bit less. There was a comment about bioidentical hormones here. So bioidentical hormones, that's actually a terminology that the FDA has come up with. We in the menopause field think of it a little bit differently. I think about bioidentical as hormones that are actually were or still being made by your ovaries. That they are body identical or identical in chemical structure to what your ovaries used to make. Estradiol and micronized progesterone. Now, bioidentical, when women were told that they shouldn't take hormone therapy, a lot of women turned to what was called bioidentical hormones, which are compounded hormones. That's the other way to think about it. Compounding pharmacies would mix up hormones to make what we were told were dangerous. Okay. Here's the thing about them. Women would take bioidentical hormones from a compounded pharmacy thinking they were more natural. They're actually not more natural because they're still synthetically made. They're brought to the compounding pharmacy and they're mixed up to make whatever the prescription says. And in fact, they may be a little bit, I'm not going to say more dangerous, but you have to be careful because you're at the behest of the pharmacist, the compounding pharmacist, to hopefully make it the same way each time. Hopefully that it's as pure and as potent as it needs to be. And hopefully there's no evidence of contamination or anything going on in that compounding pharmacy that can potentially contaminate or change the makeup of that hormone. So just be aware that we consider bioidentical hormones as hormones that were made by your ovaries, estradiol and micronized progesterone. Some people think about it as compounded hormones that you get from the compounding pharmacy. Okay, so I have a question to my girls. What do you want to get out of what you see me preaching to women? How are you going to move forward in terms of thinking about maturing, how you feel like you're going to take care of your body or advocate for yourself? Do you have any specific thoughts on that?
You go first. You want to go? No,
Sure. I think I said a bit of this. Sorry, lean over you. I think I mentioned a bit of this earlier, but I think that what I plan to take forward from this, aside from the knowledge itself and knowing what my options are and knowing that I can start tracking my symptoms earlier, keeping track of changes within my body and discussing that with my provider, I think the advocacy point is really, really, really important and has helped me navigate, like I said, appointments that I'm even having now as a 20-something-year-old, whether it's medical appointments or other things that are really central to my health and well-being. Being able to have a foundation of what I'm feeling so that I'm taken seriously, so I can walk in feeling prepared, confident, and not necessarily demanding respect, but also asserting that, like, hey, I've done my homework, so now it's provider or whoever's on the other end of the line, now it's time for you to step up and do the same for me. I've given you everything that I can, and I've put you in the best position to take care of me, so now would love to have a dialogue with you about what my options are and how to proceed. And so I think that a lot of the undertones of what you've been sharing online, but also within our family and to your friends and other folks, is just come in prepared and knowing yourself. And as a result, you're going to be able to have better discussions with your provider, but you're also going to give the people around you a better chance to not only get educated on your situation, but also give them the chance to give you some grace and patience and to hopefully meet you where you are in this moment in time. And I think that education and cultivation of empathy is really, really important, especially during this time.
Lauren mentioned something about preparation for your appointments. And this is kind of a plug for something that she helped me make, and it's called the Menopause Guide. If you go to the link in my bio, Instagram and TikTok, it will take you to something called the Menopause Guide, and it basically allows you to structure your appointments. And this doesn't just mean your OBGYN or your menopause specialist. Every appointment that you go to, it helps you to, for symptoms, there's a whole symptomatology list that you can check off. Do you have this symptom? Never, sometimes, always. It helps you to categorize and say, oh, yes, I've got that symptom or this symptom. And then it has a section for your top 3 bothersome symptoms. So it helps to focus you. That doesn't mean you won't be able to talk about the others, because I can tell you, talking to patients, we start off with 3 and we end up with 20. So just know that is a starting point. If you come prepared to your appointment, I can just about guarantee your appointment will go better. You will be able to focus in on those things that you want to talk about with your provider. And I can tell you, women get nervous. They come in and they think I'm going to say no about everything. And after the appointment, I get goosebumps, because you could see that veil of despair come down when a woman feels acknowledged or validated. To me, this Menopause Guide helps you to get that information out to your provider so that your provider can start thinking through clearly about your symptoms, because you have presented them more clearly than you might have without that guide. So link in my bio, go ahead and download it, share it with friends, photocopy it. I don't know how mobile ready it is, so please don't get on me about that, because we are not as technically savvy as you might think.
But we're working on it.
They're working on it. They're working on it.
You should be able to fill it out on your phone in some capacity. Take a screenshot and bring that to your appointment.
Yeah.
Jenna.
Yeah. I mean, I would second really a lot of what Lauren was saying in terms of advocacy and coming into your appointments prepared. I mean, obviously, I'm not coming to my GYN and saying, oh my God, I have menopause. But I think that there are a lot of different kind of biological transitions that are happening even at my age. But I think one of the really, really important lessons that I've taken from this is that you don't have to sit in your own discomfort as a way of pulling up your bootstraps. I think so I've been an athlete all of my life, and I think that we are so conditioned to say, well, it hurts, put some dirt on it, and you'll be okay. And I think that there is something to say about grit. But I think that understanding your body and understanding that something is wrong and taking deliberate steps to fix that and not sitting in your own discomfort is something that even I've learned. And something that I can really think that can help people over time. And it's just a very underlying lesson that I've learned here. Obviously, going to your doctor and noticing the symptoms early, I think is super important. But I think as a life lesson of, hey, I'm feeling bad. Let me talk to my friends, my family about it. Let me research my symptoms. Let me make sure that I'm doing as much as I can to be happy in my own life, and taking the steps to do that, I think is super important. Something that I'll take away from this for sure. Yeah.
Honey, Lotus, Mommy, what did you take away from this?
All things.
Oh, take what? Oh, it's just
The short version.
the short version.
Does that exist?
What do I take away? Just the information that you are spreading through social media, which we didn't have at that time, my time and generation, when I was your age, and like I said, going back and looking over things and saying, oh, is that why that happened? Oh, okay, that explains it, and it kind of lets you take a breath and clears something up, and maybe you can follow through and do something else. Who knows what information, when you acknowledge something or get some information about the past, that clears up things and opens the way to do other things. So this has been wonderful, sweetie. So I'm very, very proud of you. Very proud of you, and keep doing what you're doing, and including us, and for our perspective. And we are talking to our friends. I am talking to friends who are younger, and they are dying for this information. And they are my friends are so glad to get this information that it opens up a lot of explanations for things in the past.
Well, thank you. I get emotional, so I'm going to try not to, but see. Tonight wasn't really about menopause. It was about family, and it was about women, and it was about generations that we have here. I hope you all can see, but it's about generations and how our generations pass on information from one to another, and how we receive that information and what we do with that information. I can tell you that, obviously we talk a lot in our family. A lot of families don't talk a lot, but hopefully this will allow you to go to your families and have conversations that may be difficult, but I would say that they're necessary. And take these conversations and move them forward so that they're normalized. And the more you talk about something, the more people might hear it. If you talk a little bit loudly, they're going to kind of look up and say, what's that? If you start screaming about it, like I have tried to do, then people are forced to listen. And they're forced to say, what the heck is she keep talking about? And then they stop, and things start to connect. Some dots that were out there start to connect. And they may not connect right away, but know that those dots are out there. And know that certainly they can be connected. Not everything is due to perimenopause and menopause. So I encourage you as women, as your partners, whoever your partners are, to not just sit and sulk, but go get help. Not to blame one thing on one thing and one thing only. Go to your doctor. If your doctor dismisses you, you can give them one more chance. And if they dismiss you again, peace out, keep moving on. Because you've got to advocate for yourself. Again, that squeaky wheel will get that oil. The more and more you come back, even to the same physician, they're going to get tired of you. And they're going to be forced to listen and hopefully do some research to say, what is this woman talking about?
They need to educate themselves.
That's a whole nother live about how I wasn't taught about menopause and residency, and how most practitioners today are not comfortable or feel that they have adequate education to talk about it. So I say this, thank you so much for joining us, all three generations. Thank you, Sydney Lauren.
Behind the scenes.
Working
behind the scenes.
She was working it, our producer. This has been very special and heartwarming to me because, we're all in this together at different phases, and I appreciate everybody's support that you've given me. That's what keeps me going as well. So, as I always say, advocate for yourself And when you think you don't got it,
You got this. I missed that.
have a great week coming up, and we'll see you when we see you.